Hi everyone. Our research article we chose to do is Hearing Aids' Effect on Speech and Language Development.
Our agenda for today will be theoretical framework, research questions and hypotheses, methods, findings, and real-world implications.
Before we got started, we just wanted to introduce ourselves a little bit. Um, so we have Emily, who's the audiology student, and then me and Logan, who we are speech therapy students.
Okay, so the theoretical framework for this research article, for one, we have poor communication. By the end of preschool, children with poor communication skills are more likely to have social and academic deficits. Also, in early childhood, this is when children are in their critical period for language development. Without access to auditory input like hearing aids, hearing loss during early childhood can contribute to poor speech and language skills. And then access to intervention, access to hearing aids improve speech audibility. The intended effects of hearing aids in children is to help enhance speech and language development.
All right, next we're going to be talking about the research questions and hypotheses. So question one is the audibility, which is how much sound the child is hearing, provided by hearing aids for children with mild to severe hearing loss associated with differences in speech and language outcomes during the preschool years. Question two being, does the benefit of aided hearing occur across different levels of hearing loss, including mild? Question three, is there an interaction between aided hearing ability and the length of hearing aid use in influencing speech and language development? The hypotheses are one being the audibility provided by hearing aids for children with mild to severe hearing loss would positively be associated with differences in speech and language outcomes during the preschool years. Number two, the benefits of aided hearing occurs across all different levels of hearing loss. And then three, the longer duration of hearing aid use would result in a positive effect on speech and language development.
This study used children from ages 6 months to 7 years who have bilateral hearing loss from both Midwestern and Central East Coast states. This study focuses on 180 hard of hearing children who are evaluated at ages 3 and 5 during the study. The study used multi-center and a longitudinal study. The centers that they used are Boys Town National Research Hospital, the University of Iowa, and the University of North Carolina, Chapel Hill. The multi-center study means that it was done at multiple locations, and it was longitudinal because it was following the same children over time. The way speech sound production was measured was through a variety of different assessments. 33 children participated at both age levels 3 and 5 within the composite language scores.
Okay, so the findings for the study, I have each question on the left. So the question one findings, it was found that children with mild hearing loss had better speech skills than the children with moderate to severe hearing loss. Question two findings, um, audibility had a similar relationship with speech and language development for children with mild and moderate to severe hearing loss. And then question three findings, it was found that there was improved audibility provided by hearing aids, presents greater opportunities to both perceive and learn language patterns.
Some real world implications. So we have one early fittings. So this article emphasizes the support of early fittings for hearing aids. Number two, optimizing speech audibility. So there's a great importance in fitting hearing aids properly to maximize speech audibility. Number three, mild hearing loss also benefits from hearing aids. So it highlights that children with mild hearing loss also benefit from hearing aids. Many of these children are not likely to be identified and fitted for hearing aids. Um, and then encouraging consistent use. So clinicians should all monitor the audibility of their clients' hearing aids as well as encourage consistent use of them.
This article had some limitations. There was contradicting information in at least one of the paragraphs. They stated in one sentence that information did not support the hypothesis, but then later stated that it did. They also had a few grammatical errors where they had repeated words or used the wrong tense. And they also only used standardized assessments to test the child's use of language. By doing this, it can't or it won't show the functional use of the child's language.
Our discussion questions are sometimes parents will refuse getting their children hearing aids. How would you go about encouraging them to have their child use a hearing device? And number two, this article discusses the importance of both length of hearing aid use and the audibility of hearing aids. How do you think these two go hand in hand?